Welcome to the Department of Healthcare Access and Information's AB 1882 Hospital Public Notices webinar, brought to you by the Seismic Compliance Unit here at HCI. This webinar will include an overview of the AB 1882 requirements, project application process, and deadlines. Today we will cover how to add AB 1882 notices to project documentation, how to submit hospital service reports and signage applications, and what the requirements are for posting AB 1882 notices in a hospital building. If you haven't done so already, feel free to download a PDF copy of this presentation available to you in the Go To panel under the Handouts section. We're scheduled to be here for 1 hour. We have a lot of content to cover, but we will try to do a question and answer session at the end of the presentation if time permits. If you have a question during the presentation, please type your question into the questions section of the Go To panel, and we will try to answer them at the end of the presentation. Please be sure to keep your questions generic, but if you have a specific question about a specific project, please feel free to email your questions to seismiccomplianceunit@hci.ca.gov. That's seismiccomplianceunit@hcai.ca.gov. If the presentation experiences transmission difficulties, please log out and log back in using the same login information sent to you by GoTo when you registered for the presentation. And we will do the same if we are experiencing transmission difficulties on our end. AIA credit. In coordination with AIA California, you will be able to earn 1 AIA continuing education unit by attending the entire presentation. If you have questions regarding continuing education units, please contact AIA California directly. You should note that multiple staff members from one office should register individually to receive separate logins for individual certificates. If you do not register as yourself and attend the webinar under your own login, we will not be able to report your attendance to AIA. A certificate of completion will be emailed from GoToWebinar to registered attendees who logged in and attended the entire presentation. Note that certificates will not be available from HCI. So for today's presenters, we have with us Ali Sumer, Supervisor of the Seismic Compliance Unit here at HCI Office of Statewide Hospital Planning and Development. Once again, thank you for joining us today, and without further ado, I hand the presentation over to you, Ali.
Thanks, Kelly. Good morning, everyone. So I'd like to first start with thanking Patrick Rogers and Kelly Zimmer to put this presentation together. They did a lot of work in the background to make this happen. Just couple reminders, couple pointers before I start the presentation. So back in June 20th, we had the MPC 344D5 and AB 1882 webinar. The recording and the slides are available on our website. Following that, on August 22nd, we had an MPC 5 webinar. That recording will be out shortly. And today's webinar, AB 1882, this is a recorded session, and the slides are available right now. With that, I will go forward. So if you attended June 20th webinar for AB 1882, I went over the program on a high level. This webinar will really go into detail with some examples, step-by-step application process. So this webinar has a whole lot more compared to the last one. Starting with some definitions, and this is about 2030 seismic compliant term. So throughout the webinar, I will be mentioning 2030 compliant or 2030 seismic compliant. What that means is SPC, if the general acute care building is SPC 3, 4D, 4, 5, and NPC 5, it is 2030 compliant. If it is not this combination currently, it is not 2030 compliant yet. These are the inventory breakdown for SPC and NPC. So if we look at the SPC chart, 3, 4, 5, so this is the structural compliant section, and SPC 1, 2 is 2030 not compliant section. For NPC, pretty much this whole chart, except that blue slice, is not compliant. So what is AB 1882? Basically, it's to seek to raise the awareness for general public, and it tries to inform the public about the current status of the seismic compliance of these general acute care buildings, and it tries to achieve that through 5 items. Item number 1 is the seismic information that's required to be published on our website, which we already did, so this is done. Item number 2 is requirement to show some seismic information on project documentation, which was effective earlier this year. Item number 3 is updating emergency training, response, recovery plans, and capital outlay plans, effective July of this year. Number 4 is the services reporting and annual status update. So the deadline is at the end of this year and then annually after that. And the final item is the signage that goes on these buildings, and the deadline is at the end of this year. So at the bottom of the slide, you will see these boxes that for each of these item 1, 2, 3, 4, 5, we'll try to track that as I move forward with the slides. So the implementation, the law AB 1882 implementation was done through the PIN 75 and regulations. So 1882 was signed into law last year. Following that, in a couple months, we published PIN 75. So we put the requirements on how to implement AB 1882 in PIN 75. We published it at the end of 2022 and did some revisions, modifications a few months after that. We also carried PIN 75 into the California Administrative Code, and the publication date of that one is at the end of this year. So the first requirement is the HCI website. And basically, there's a certain sentence that the law requires to be published on our website for SPC2 buildings. What that says is these buildings do not significantly jeopardize life, but may not be repairable or functional following an earthquake. For SPC5 and PC5 buildings, the buildings are identified on the HCI website as earthquake resilient. So that's what we did on our website. So if you go to HCI website, follow the building safety finance, click on the facility detail, and put your facility on the drop-down list. Then you click on the building list seismic information. Then you will see a lot of details about these general acute care buildings. So you will see if you have an SPC2 in your inventory, this orange sentence pops up. And similarly for SPC5 and PC5, the earthquake resilient, the green words here appear. So if you recently go to our website, when you start seeing these it's really an AB 1882 requirement. So let me actually go back one. These building numbers and building names, sometimes it is not obvious where we are referring to. So on our website, please go to the site plan and see where each of these buildings are and what number corresponds to what name. Sometimes people refer to building 1 or original building, but in our records, we really go with the assigned BLD number. So these red lines denotes the seismic separation between each building. So the location of the department does not dictate the boundaries of the building. The boundaries of the building are with the seismic joints. So structurally, this is one building. For example, this nursing tower is one building, and that's the boundary. These boundaries are important to note because I will show some examples about the signage location services reporting, and it matters where the services or signage are with respect to these seismic joints. Okay, going to project documentation. So again, this was effective earlier this year. So if you already got a comment from our reviewers about please add this sentence, and a lot of people are surprised, this is the background. When we receive an SPC2 building, let's say there's a new design, new building, or new project, new TI project, it shall include a building identification sentence, this highlighted sentence. And this is a requirement for SPC5 and PC5. It is optional to put earthquake resilient on the documentation. So the law says, all documentation. So what we did is we received thousands of different documentation every year. So to keep things more simple and straightforward, on the PIN we clarified, or we identified that on only the title sheet of construction drawings and title sheet of specifications, that's where it's going to go. We are not requiring to have that sentence on additional documents such as the change orders, RFIs, calculations, testing, inspection, ETIOs. So we are excluding all that. Also, on the title sheet of seismic compliance evaluation reports, we are requiring to put the sentence per AB 1882. So what are the examples? For example, if there's this A 0.0 architectural sheet, which is the title sheet of the project, we say, okay, somewhere here with this AB 1882 notice, please put the sentence somewhere here. The font size, there is no required font size, something reasonable. If the title sheet is crowded, such as this T-1.0, again, maybe right next to seismic design criteria, it can be somewhere on the key map. So somewhere that makes sense with a reasonable font size. If there are multiple buildings in a project, please note which SPC2 building or which building does this refer to. Item number 3 is the emergency training response and recovery plans and capital outlay plans. So the law basically says July 1st, 2023, the general acute care building owners shall do both of the following annually until each of the hospital building owned by the hospital building is compliant with this section. So what are those things? Basically including the information regarding the earthquake performance in emergency training, response and recovery plans, and including that information in the capital outlay plans. Now, these plans, where do these plans go? the law does not require those plans to be submitted to OSHPD. So this is your document, and the law requires to update them, but the facilities don't need to submit to us. So the responsibility is on the facility side. Now let's go to item 4 and 5. So these will take some time to go through. So annual status reporting, what we really mean by that one is reporting two things. One, the services and the corresponding structural performance category ratings. So, and these things are valid when a building is not seismic, 2030 seismic compliant. So what is to be reported? So let me give an example directly. Let's say there are 10 buildings in a facility with various NPC, SPC ratings, such as one of them is SPC2, NPC3, and all other 9 is SPC5, NPC5. So the law says all services in all general acute care buildings, including SPC2 and SPC5 buildings, are required to be reported annually per this section. So the idea is to make sure that all buildings comply, and then the reporting requirement goes away. So this is the annual report. So when if the services don't change, it's basically resubmitting the same services report every year, and I'll show you how to do that quickly. How is it reported? Again, in this webinar, I will show examples for reporting and signage. So we developed a new record type for this reporting, and it's really streamlined. It's in our typical e-services portal on our website. So if you ever submitted a project to us, you will be very familiar about how to open one. When is the reporting? So this is an annual reporting, and we came up with what would be reasonable to get all these applications in and process them and do that annually. So each year the reporting will be between November 1st and through December 1st. However, since this is the first year and a lot of people are getting trained and informed about this program, we already opened the reporting portal. So actually, we got many applications already, and with these webinars, seminars, now things will hopefully accelerate even more. So the application deadline is December 1st. Now, what happens between December 1st and January 1st, which January 1st is the law deadline? So we're gonna call it late facilities. So the facilities that sends an application between December 1st and January 1st, we will still process them. So because the law gives time till January 1st. However, we also need time for all these facilities to be processed. So the ones that submit us by December 1st will be able to publish their services report by January 1st. The ones that get submitted December 1st to January 1st, we will do our best to do it by January 1st, but we are anticipating that probably it's going to be in the early part of the next year. So again, deadlines are, a lot of people, I'm guessing that December 31st they will click the button, so there's no way for us to get all that in by by the next morning. So anyways, this is the target. We are hoping to get this done mostly by December 1st, and then hopefully a small number of facilities will be taken care of between December 1st and January 1st. So the report we will publish it on our website, and again, for those who submit before December 1st, and a PDF report will be posted. Now, why are we doing a PDF report? Because the facility can take that coincides information and send it to other entities. What other entities are we talking about? The law basically requires that information to be sent to 9 entities. Our department is one of them. So what we are doing is we are basically trying to collect that information, put it in a table format, so that the information that is shared to all other entities are consistent. So, but again, we are not sending that information to other 8 entities. That's the facility's responsibility. We are one of them. We are trying to get a consistent information and format. So that's why we try to do it a bit earlier, before January 1st, so that by January 1st, all of these entities are informed. So we are not tracking where the facility is submitting and who they are submitting to. Okay, so service reporting. We published a user guide on this application process. It's on our website. It is 1 application per facility. There's no application fee. It's user guide 25, and here's the link, the PDF that is available on the GoToWebinar right now. If you click on it, it should take you to this PDF directly. And I'll show you an example, but one thing to note is once you open a project for ESP, the project number will look like this: GAC-SERV, GAC serve, the year number, and the project number. So we are not allowing the reporting in any construction project. This is a special type record number in our application. So please use this. Now, let me, so how to apply? Again, just going to our eServices portal, log in with your username and password as usual. Now, if you don't have the facility PIN number, and the PIN number is not the username and password. PIN number is a facility specific number. If you don't have that, you won't be able to submit the application. You can prepare the application, save the application, but you won't be able to submit the application. So a lot of people, go through the application and then realize that they don't have a PIN number. The PIN number is asked at the last step. So having said that, now let's create an application. So you create, but you're gonna basically, we are not in the projects tab, we are in the enforcement tab. Create an application link. So you're gonna see this menu. Basically what it is that in the hospital reporting, there are 2 types: hospital services reporting, which I'm covering right now, and later in this presentation, I'm gonna go to hospital signage reporting. Okay, so if you click on hospital services reporting, it's gonna take you, okay, which facility are you trying to report on? You type on your facility ID, and it's gonna pre-populate a lot of information for you. And then it will ask, okay, which contact is this submitted by? You can select from the facilities already established contacts. If you're a new person, then you can add new, you enter your information. Right after that, now this screen comes up. So what we did is, in order to make things pretty consistent, we pre-populated all your buildings under this record type. So if you have 18 buildings, we already pre-populated all of those 18 buildings in this application. So with the building number, the name, so you're gonna basically go through one by one. So let's say, you know, footbridge, and you edit that, and then this pops up. Okay, which services are in this building? You basically check whatever is applicable to that building. Again, with the seismic line boundary, within the boundary of that building. So sometimes some services span 2 buildings. So for example, administration is in, I don't know, footbridge, and there is also administration in this building. So it's not just only one check per thing, whatever applies. So there are also services that are not listed here, but it is a non-general acute care service. Then you can select that, and which I will come to that. But it's really pretty straightforward. The buildings are pre-populated. The services are basically given as an option. You just click on whatever is applicable. Right after that, you put your PIN code, and then you're done. So that's the whole application process for service reporting. It's very straightforward. We don't need to know the number of beds, this and that. So if you are a seasoned administrator, you remember SP 499 days. It's nothing like that. This is all it is. What are we reviewing in this pretty straightforward check application? Our review is like very high level, 30,000 feet. We are not questioning the details of the services that you checked. We are not verifying those things. We are basically trying to collect your reporting information. What we are looking for is really to catch that very like big, obvious, major mistakes, such as you know, there's a facility who reported there were like no basic services checked in any of the buildings. So obviously that's the oversight. So we just say, hey, you know, you forgot to check these things, and then they corrected it. Or while the applicant is filling this information out, they keep checking the same thing for each building, like pharmacy, 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 pharmacy. So obviously that's a mistake. And also there are some obvious things that happens on every general acute care facility, such as central utility plant and or mechanical electrical source equipment. So it is somewhere in one of those buildings. So at least 1 or 2 should have that checked. Sometimes people submit without checking anything. So if all the checkboxes are empty and the non-GAC uses blank, then we basically push back saying that, hey, you forgot to do that. Once we accept this services reporting, this is really our acceptance of services report does not constitute approval of use. So this is not a CDPH application. This is not a licensing application. So our acceptance doesn't mean that you can, you know, now start a new service. This is just what you told us, and we're gonna publish it. So a little more about non-general acute care services. So there are OSHPD 1 buildings that have some non-GAC uses. So such as corridors, canopies, you know, outpatient clinic space, and some other non-GAC uses. If the building is non-GAC use, all of them, and it is not OSHPD 1, then it's not part of the reporting requirement. It doesn't have an SPC or MPC rating. So if there's a mistake in the list, please let us know. We will be happy to take care of that discrepancy. But sometimes we get that question is like, there's no GAC use, why am I reporting it? Well, it's an OSHPD 1 building. So if it's an OSHPD 1 building, that means that it's a GAC building. So please tell us what's inside of that building. So after getting that information, after we review it, we accept it, then what happens? So Sharp Coronado actually already submitted their reporting. And what we did is we accepted the services, and following that, we actually opened a new tab under our facility detail, which you will see building services. So this wasn't here before. So if you click on it, this is what you're gonna see. So if you go to our website right now, this is visible. So all the checkbox items that was in the application, we put it here. We kind of a bit reorganized it, the 8 basic services and support service supplemental. So we try to categorize with a little different coloring. But the bottom line is the checklist is here. So it will show all the GAC buildings with the SPC and PC, corresponding SPC and PC rating. So hopefully soon we're gonna add another little feature to easily download this one with the sitemap and some more information, so it's more concise report to be shared. But if you ever wanna download this one, there's a little hidden download button at the bottom right. This is a Tableau function, so you can download as a PDF if you want to. So there's a little instruction here at the bottom. So in this presentation, I tried to add as much frequently asked questions as possible, because when you have a slide deck, you don't have access to a lot of the explanation. So a lot of things that I mentioned is kind of captured in some of these frequently asked questions. So as you saw the process, you really don't need a design professional to submit service reporting. It's really anyone knowledgeable in the facility side who has a PIN can do that. An authorized rep can go into our system, do it without a design professional. There's nothing wrong hiring a design professional with the PIN shared to do it for you, but it's pretty straightforward. Who must report? Again, all GACs with 2030 non-compliant buildings. So there are a lot of caveats in terms of which GACs. Sometimes they say, well, we are acute rehab. Well, if your license shows you're a general acute care hospital, then you are required to report. So documents, again, as you saw the application process, we are not asking any document. We are not asking any verification for this reporting. Well, again, what if you don't have any GAC functions but general care hospital? As I said, just let us know if there's a license update that needs to happen. Please please contact CDPH. If that already happened, please inform us so that we correct our inventory list. So please don't leave everything blank, because we blank meaning that the services, because we will remark that application saying that, well, there's some service in that building. So you will get a remarks letter. What if we are missing a building in that list? What if you need to add a building to the inventory that we missed? Basically, It's a two-step process. Contact seismic compliance unit, saying that here's an add a building package. Patrick Rogers actually, he takes that quickly, assigns a new building number, and then we will add it to the reporting feature for your facility, and then you can select the services and submit it. What if something got already demolished, or it was already removed from GAC building, or went to local jurisdiction? You know, whatever the reason. What's the process? Actually, it's the same process. Contact us. We will remove it from the inventory. If a building is OSHPD 1R that doesn't have an SPC or NPC rating, which means that that is not part of the reporting requirement. Same for SNF buildings, and same for OSHPD 5 buildings. Okay, so now let's go to our last item, the signage. The signage, again, the idea is if it is not 2030 compliant, the signage is required. The deadline for the signage is January 1st, 2024. So the law says that these buildings shall post a notice in a public space designated as any lobby or waiting area. So the rest of the slides will try to explain the location of the signage, what it looks like, how frequent it should be, and the process of getting that approved and tracked. So the proposed location and the content are required to be accepted by us through an application. And there are many buildings that doesn't have lobby or waiting area. So what are we gonna do with those? So the general rule is we will look at those things case by case basis, but there are also some overall rules that we are exempting a bunch of them. What will the sign, what does it look at? Does it have to be an ADA compliant with the Braille? Basically, we are following the rules, but this is an informational signage, so a lot of ADA and Braille requirements don't apply. What we came up with is a certain format for consistent messaging, and the size of the sign is 8.5 by 14 inches. So this is something that most printers can produce. This is the signage. So let me break this down a little bit. So consider this as 8.5 by 14, and it has an SPC rating information. Public doesn't know what an SPC is. With the consultation of Hospital Building Safety Board, we renamed or tried to explain structural performance category by structural integrity, and NPC, non-structural performance criteria, we replaced it by equipment and systems critical to patient care. Initially, we thought about putting SPC1, SPC2. Again, that's not relevant to public. So 1, 2, 3, 4, 4D, and 5, and 1 through 5. With the speedometer and the color, it kind of gives an overall feel of the rating. There are certain sentences for each of these SPC ratings. And obviously, this doesn't tell the whole story or information behind it. So we put a QR code. Actually, if you take your cell phone, any cell phone right now, and bring it to this QR code, it will take you to a certain page, and it has more explanation. This page is not to your specific facility. This is a more general information. And in this sign, we have a fillable field here to insert the facility number and the corresponding building number. Pin 75 has all the combinations at the end of the document with so SPC2, 3, 4, 4D5. So there are all the combinations. It's just basically finding the right one at that pin 75 and print it out. What are the combinations? SPC 1 through 5 and PC 1 through 5. So these are the combinations. So the yellow ones are required, the green ones are optional, meaning that if your facility is SPC 5 and PC 5, it's not required to post a notice for that building. But if the facility chooses to do so, we gave a notice type, and there are different types of which I will show, so you can post that. What's the logic behind that? If it is not required, why would you post it? If your 8 buildings are in the yellow category and 2 doesn't have a notice, maybe public may perceive that as also non-compliant buildings. So just to make differentiation, but it's up to the facility to decide if they want to put the notices for this green category. These are the different combinations of sentences for each type, and that the sign reflects these sentences. So anyways, different combinations have different sentences, so that's what it is. That QR code takes the user or the public to a certain web page on our website. It's not just our general web page. We are continuously developing our web page. Actually, we did another update yesterday, so we are trying to make this as public user friendly as possible. Again, it's a challenge about explaining very technical things to non-technical people. So we will continue to make this information friendly to non-technical people as possible for the rest of the year. And some hospitals are already taking some steps to explain on their own terms. So we'd like to see those examples. Maybe we will take some of those suggestions and put it on our website. All right, application process. What is involved in the signage application? So we have a user guide for that. So all the steps that I'm showing is in this user guide. Unlike the services reporting, the signage application is 1 per building. The services was 1 for the whole facility that has all the buildings in it. This one is 1 per building. Again, no $250 application fee. It's a very streamlined process. On your PDF, if you click on this link, it should take you directly to this user guide. Again, we have a quick review process for the signage. I will show you 2-3 examples on this here. No permit is generated. So this is not a construction project. The project number, once you go through the guide, it will look like something like this. GAC-SIGN, GAC sign, year, and the application. So we are not allowing this signage to be part of any construction project because that's a tracking nightmare. Okay, so how do we do the application? So if I go through that quickly, you go to our eServices portal, put your username and password, and again, if you don't have facility PIN number, you won't be able to submit it. So make sure that you have that. Create an application similar to services. This time you choose, instead of services, this time you choose signage. So once you do that, it asks, okay, which facility are you talking about? You put your facility, it populates the information for you. You select the right person or add a new authorized person. Fill out the information for that individual. Now the form will ask, okay, which building are we talking about, and which floor plans and signage that needs to be reviewed. So on step 6, you add the building, and step 7, you add an attachment for a floor plan and the signage. So 2 files that is required to be uploaded. So this is how to add your 2 files. One is floor plan, the second one is the signage, and I will show what they look like. And after you upload these 2, continue, you put your PIN, then you are done submitting. So it's basically those 8 steps, information, 2 plans, or two PDF files, and you put your PIN, you're done. The signage PDF file is the page from PIN 75, the appropriate facility number, building number, and SPC and PC rating. So that's one. And the floor plan, indicating signage locations per building. And this is an example. So again, each campus has multiple buildings. So the yellow one is one building, the green one is another building, red is another building, blue is another building. So there are 1, 2, 3, 4 buildings. So for this building, the proposed signage location is at the lobby or waiting areas. So the proposed location is 1, 2, 3 waiting areas and lobbies. There are more lobbies, like I see waiting room here and a couple other little things. We are accepting this because we felt that this is capturing most waiting areas or the critical ones, and this is good. For these little buildings, for this one in that there, the blue, there is a waiting area here. Again, as you see, the signage is different for each building because it has different SPC and PC ratings. So one goes there and one goes there. So you are also noticing that the plan doesn't show, how many inches from the ground, how many inches from the left, from that. No, it's an approximate location in the waiting area. So it's basically an approximate pointing to that location is good. Another submittal, actually we have received over 50 now. So what if there is no waiting area? So what do we do? Actually, this particular project is indicated, okay, there's no waiting area, we're gonna just put it somewhere here. This is the building boundary. And actually, this is a very nice touch here. There's an area photo that says, okay, we're gonna put something right here like this, which is very nice. They also have a legend saying that waiting lobby, not assigned building boundary. So it really captures what we are looking for. Here's another example. This is again multiple buildings. This time the administrator put, okay, this is number 1, main lobby. I'm gonna put the ER lobby because there's another one here, and there's 2 other buildings, so number 3 and number 4. These are the places that we're gonna put. Here are the sign locations in one PDF. It really shows all the places, and this facility submitted this 1, 2, 3 times, and with the different signage, and we approved it. Okay, so Again, I'm gonna cover a little bit different frequently asked questions. But before I go, as you see, it's a pretty straightforward process in terms of the signage and the how we'd like to receive and review. So let's go through some of these frequently asked questions. Again, the proposed location. So first, in the if I go back here, this is a proposal from the facility saying that we are proposing at location number 1, location number 2, and let's say, yeah, we feel okay, this is good. But what if this was a 10-story building, and the proposal is only putting it at the very entrance and nothing else at the upper floors? Then we will basically remark it saying that, please show the upper floor plans and indicate the waiting areas, and please choose some proposed locations for the upper floors. So that's why the proposed location and content of the notice are required to be accepted by the department. So hopefully, after going one cycle with all the facilities, this will become a quite quick process. And I mentioned that how to do the user guide and the documents. I think we went through that pretty thoroughly. It's just 2 documents. Let me. Okay, this is probably the most question that we get. Is it only 1 notice per building? So we are not trying to put the notice on every single lobby and waiting area. So we are not trying to do that. We are trying to capture the major ones and a reasonable number of posting locations. Again, if you have a 10-story building, it's not just 1 location. So there are many waiting areas at the upper floors. We want to make sure that we capture those. But again, not every single one of them. So something reduced is acceptable. We received a project in a construction project with this signage. That's not acceptable. Again, we have a tracking system, and the user guide 26 really is the way to go to get that applications in. Okay, so let's go through again another super frequently asked question. The buildings without lobby or waiting areas, what do we do? So to start, it's going to be one case-by-case basis. However, we are not requiring for equipment yards, tunnels, canopies, cooling towers, emergency generator enclosure. So if it is one of them, you do not need to submit posting project. So if you choose to post it, that's fine, but we are not requiring, plus it is not practical. So the other things like central utility plant, yes, we are requiring on a case-by-case basis. Okay, what material should that sign be? Is it a does it have to be plastic? Does it have to be, glass or whatever? There's no material type requirement. The general idea is if you print on a piece of paper, color paper, there are many information signs that the hospitals do. So it's very similar to that. Again, our requirement is no deviation from the format and the content. And if you just put it in a plastic sleeve to protect from damage, that would be ideal. Again, a general location pointing to the approximate area is acceptable. Actually, we prefer not to give exact exact measured distance, so that there's no like, oh, you are 49.5 inches, half inches off. So we don't want to have that conversation. Oh, before I go to the next one. So once that project is accepted, so there's no permit, and what happens after that is one of our field staff, it can be DSC, compliance officer, fire life safety, whoever is scheduled to go to the site, they will go there, verify it, and they're gonna just check the box saying that yes, it is where they said it's the right sign. Then the project gets closed, which means that, as I mentioned, this doesn't include any IOR or design professional or any construction team. It's basically our field staff going and taking a look at where it is and if it is the right sign at the right location. And that's all it is. So review and approval, the first maybe couple hundred building batches will be done by seismic compliance unit, and then we will start shifting it to region and field staff. So eventually, when this becomes a typical project, we are hoping that the field staff will take care 100% of start to finish. Again, do you need to do kickoff with the field staff? Do you need to do any of these things? No. Do you need an IOR, TIO, VCR, DPR, all the acronyms? No. Can you move the sign? If it is just a approximate little shift, no problem. But if you are moving it to a different room, different place, then please submit a new signage application. Visual imprint required? No, Braille signage is not required. If the building is SPC or MPC rating changes, let's say you upgraded MPC 2 to MPC 4D, then please send us a revised signage application. Again, you can use the same floor plan with the updated signage file, and that's pretty much it. This is another question that we get frequently. There are some facilities are expressing some interest to put more information about what the signage is about. So they are thinking to put some supplemental information next to the sign about, okay, these are the efforts that are ongoing for the seismic retrofit. So all of that is just good information. We are leaving that up to the facility about how much supplemental information that they want to do. That's all up to them, provided that that supplemental information does not interfere with our signage. Again, no deviation from our notice format. The format remains as is. One last item that I want to touch on is when you look at the inventory, the building inventory, you may notice that there are the letter S right next to following SPC or MPC ratings. What does that mean? The S designation is a reported SPC MPC rating, such as when the facility says, okay, according to us, this is an MPC, SPC 5, MPC 4, or SPC 2, MPC 2 building. But if there's a remarks letter saying that maybe information is missing, or we didn't agree to that SPC MPC rating, then it remains as S, meaning that this is what was proposed, but we have not agreed to it, which means that there's something that needs to be done about this S before you publish a correct rating. So if the building is under construction, obviously it's going to have this 4S, 5S, but there is no building to post it to begin with. But other cases where there is an S designation, we need to clear that. So it's 12 o'clock. So Kelly, do you want to close the webinar?
Yes, thank you, Ali. This brings us to the end of our presentation. We hope that you all found this webinar to be helpful. Please remember, if you didn't download the PDF handout, you can find and download it under the Handouts section of the GoTo panel. Alternatively, the slide handout will be available on the HCI website in approximately 1 week following accessibility remediation. Today's session has been recorded and will be available on the HCI website under Building Safety and Finance, Training and Education in about 4 or 5 weeks' time following closed captioning and accessibility remediation. If you have any questions about this presentation, or if we didn't get to your question today, please feel free to email them to Seismic Compliance Unit at hcai.ca.gov. It's been a pleasure being with you all today, and thank you for doing your part in providing access to safe, quality healthcare environments throughout the state of California. Thank you.